Well, hello you. Just close you in there. How are you doing today? Wonderful. Well, the truth is, you are being seen by Dr. Love. That's right, that's what they call me. I mean, I'm a heart specialist, but, you know, work with the heart, give out love, save lives. It's all the same kind of thing, isn't it? I must say, you don't look anything like what I thought you would. I mean, it said here you're 52. I expected you to be a bit old, but great shape, aren't you? You've always been in such good shape. Have you? Shut over, let me on. Really? Wow, that's something special. I'm just going to scrub up a little bit for you because I'm going to need to give you a really good examination. If you're alright with that, obviously. Why wouldn't you be? I bet you can't wait for me to get my hands all over you. That's what all the other patients say. Yeah, they do. Dr. Love, come in here, put your hands all over me. Something like that, I'm not sure. Anyway, sorry, terribly flirty of me. Got a reputation, you know. Well, you know, reputation to keep. Anyway, right, so let's do a quick check on your pulse first. I'm just going to pop on some gloves for you. Is that alright? Do you like it when I put my gloves on? Are you one of those? I bet you do, don't you? It's quite special, isn't it? It's an intimate relationship, I think, between your doctor and yourself and those gloves. I mean, no other relationship in the world like it, is there? Love my job, as I'm certain you can tell. Do you love my job? Oh, don't be so silly. Who wouldn't love a job where they get to slip their hands all over lovely gentlemen like you every day? I mean, it's not every day, I won't lie. You're really quite the exception. Right, arms up. Okay, what I want to do, can you give me your hand, please? Just pass me your hand. Bring it here. I'll take that, thank you. All right, we're just going to do a little check on it. Give me a second. Shush, please, so I can count. You're not listening. Shh, 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 shh. While I listen. Give me your hand again. Right, you be quiet and listen to my leg with the squeaks while I just quietly. Lovely. All right, very happy with that. Excellent. And we'll just give your chest a little listen to while I'm here. Okie dokie. Now, if you wouldn't mind, could you just unbutton your shirt for me? Fantastic. You can just slip it off and pop it on the side. I will need to get to your back as well. All right. And are you comfortable? Are you warm enough? It's quite cold in here, isn't it? Let me just... warm that up for you a little bit. You don't want it all cold, do you? You're cold on your lovely skin. This lovely skin you've got. You can just bring yourself in a bit for me. Now, if you don't mind, no talking. Shh, I'm just listening. All right, lovely. Pop it on the other side. Here we go. I'm just going to hold that there. Shh, don't speak. Shh, shh. Good work. Yep, lovely. Spin yourself around for me, please, so I can get to that back of yours. You have a large back, don't you? It's quite a expansive back there. Love a man with a big back. Oh. Anyway, going off task slightly. If you could just stay perfectly still. I'm going to put this on your back. Could you give me a cough, please? Just a little one. That's it. Fill up the lungs and a big like that, please. Lovely. On the other side, I'm going to ask for exactly the same thing again, please. Breathing normally. Little cough. Lovely. Absolutely fine. Spin yourself back round again. God, even your profile is lovely. Must be awkward for you in life, having to walk around being just that gorgeous. Well, obviously I understand. I get it all the time, not with the whole heart thing, but I'm sure it must be exceptionally hard for you. Yeah. Right. Talking of that lovely face, I'm actually going to give it a little check over, if that's all right. I'm going to come up quite close, and I am going to need to press on you a little. You all right with that? You're not allergic to latex in any way, are you? Oh, I bet that's been helpful during your life. Just let me, please, if you don't mind, going to really press. If you can just be quiet for a moment and just listen. That's it, you'll just hear my leather uniform while I'm just pressing the sides of your face. I'm not sure about this here, can I? Do you mind dropping your head down for me? I just want to stroke across your forehead. That's it. And the other way? There you are. There you are. No problem at all. Alright, that all seems fine. I just checked under your chin and your glands. Wonderful. No problems there. Rightio, what's next on my list? Okay. I'm going to do a quick cranial exam. So I am going to get you to follow the light, alright? Just coming in now. Left to right, please. Lovely. If I bring the light up to the left, do you see that? And down. Well done. I'm going to bring it in closer. Here it comes. Got that? Alright, lovely. On the other side, please. Follow the light up. Wonderful. Down. Bringing it in closer. I'm just going to come in a little closer. Just a little closer. Oh! What did I tell you? Dr. Love. I know it's a bit inappropriate to kiss the patients, but honestly, I've got so much love. You're alright with it, aren't you? Don't mind a little peck on the cheek, peck on the forehead. Give me that forehead. Come here, come here, come here. There you are. And the cheeks. Beautiful. And this side. Amazing. Now you can't tell me that wouldn't fix any old problem. Right. Last tool of the day, I'm going to be doing you a little sensory test. Just going to be very gently running this along your arm. You'll notice if you look up very closely, it's covered in tiny fine needles. There you are. Each one is sharp, very spiky. All I want to know is from 1 to 10, what's the sensation like? What do you think? Can you manage that? Wonderful. Right, in that case, so arm for me please, and just bring it in. Just bring it in there. Right, I'll show you on me first. We're just going to run it up and down, up and down. Alright, give me your arm please. I'm going to be running it. That's it. There you are. All the way up your arm, all the way back down onto my glove. You'll just see it coming in here. All the way back up. How's that on your arm? 1 to 10 please. 7. Alright, no, that's a good number. It's a sensitivity tech, so obviously the nerve endings in the arm are not so strong, but we are going to get to some more, shall I say, delicate areas. Coming down to your chest. If you wouldn't mind, could you sit back and just lay back for me? I'm just going to pop on a mask for this bit because I am going to be getting quite close to some of your body regions, and I wouldn't want you to be uncomfortable with me so close to you. So I'm just going to pop my mask on. Alright, lovely job. Now, lay yourself back please, just push yourself back there. Wonderful. Do you like the squeak of my leather uniform? It's quite wonderful, isn't it? I know, I'm the luckiest nurse there is. Well, heart specialist, you know. Alright, if you wouldn't mind, I'm going to start running it on your chest now. You'll feel me running it down, down, down. getting a bit more sensitive, is it? I expect it would be. Quite close to some very delicate areas. Let's try that again from the other side. I'm going to place that on your clavicle. Got it? Running down across the breast, past the nipple, down the stomach, all the way down the stomach, and we are heading in between the thighs. Right, just a little tickle there. How's that? Can I have sensitivity down by the thighs, please? Ooh, 9.5. It's extremely high. Haven't even got to anything serious yet. Just kidding. So I have. All right, last little bit I'm going to be doing here. Around the side of the scrotum. I hope that's all right. It's not too sensitive, is it? It's a 10. Oh, goodness me. I actually can see how sensitive that is. I suppose it can't be helped. It's one of those exams that causes these issues, isn't it? Yeah. All right. Last of all, I'm just going to run it along your face, okay? Sensitivity on the left-hand side of your face, please. Ready? All right, it's just coming in now. Just feel it running down. How's that? Oh, 5.5, that's all right. And we'll come in on the other side. I can just run that in. Just feel it running down the side. Same feeling? Good. Wonderful. Well, I think we should be very pleased to know that there is nothing for us to worry about. That makes me very happy, as I don't want to worry about you particularly. I like it when my patients are lovely and healthy and happy. Are you happy now you've seen me? You can say it, you are, aren't you? Most patients are happy after they've left Dr. Love. I did call myself that, to be honest. Yeah. You won't mind me saying, will you? Sorry, you've got an eyelash on your eye there. Can I just get in a bit closer? I was just going to tell you, can't get it, how absolutely beautiful your face is. Sorry, I'm taking my time here. Let me just... No, it's not coming. I'll just have to pick it a bit more. There it is. There it is. There it is, you naughty eyelash, you. Just brush your face down. Yes, I was just saying, you have amazing bone structure. Yeah. So, don't forget, if you want to take my number before you leave, don't forget to ask. Anyway, lovely to see you. You take care of yourself and I'll see you... Well, I've got down here that I'm going to see you in 3 months' time for a checkup, as I say. Feel free to call earlier if you would like to see me before that. All right then. Happy listening, my darling. I would just like to say a very big thank you for watching today, and I hope you've enjoyed. And if you have enjoyed and you like any of the medical content or any of my role play, please do like and subscribe. And for any of my more grown-up, maybe more explicit stories and role play, please join me on my Patreon or OnlyFans page. Happy listening, my darlings.